Oh,
Um, and I think that, one of the things that makes it wonderful to be able to talk to someone like you is the combination of all the expertise and knowledge,
yes.
that I'm sure we'll be able to share. So thank you for having me.
Oh, I agree. I think it's going to be a very rich conversation. And we're calling the topic fertility breakthroughs because I think that we've been hearing about the fertility pandemic, epidemic, 1 in 5 now suffering. And I think you and I would agree that much of that population is not necessarily infertile. They're struggling with, physiological issues that are affecting their fertility, but they are not technically infertile, and that when we reverse those illnesses or those imbalances, they can restore their own health, including their fertile health, and enjoy a healthy pregnancy and a healthy baby and a healthy postpartum and family.
And so I immediately re kind of charted my course to
Mhm.
something else, which I didn't know what it was going to be. And one day I remember going to clinic because, you have to do a million clinic hours to be able to graduate. And I remember going to clinic and seeing this little poster on this stairwell that I just kept going up. Natural fertility clinic hours, additional clinic hours for students. I'm like, that's it, fertility. That's what I'm going to specialize in. And so that essentially was the moment. As I started working with women's health and seeing people who were struggling to get pregnant, it was always kind of like a year or a couple of years.
Yeah.
Um, that basically continued for about a decade. And of course, I started to become known for the person to come to if I was just, having difficulty conceiving.
Right. And
And
this
then
was in a
about
brick and
10
mortar. This
years
is
in,
this was in a
this was in my
physical.
brick and mortar clinic.
Mhm, mhm.
Yes, yes. Then 10 years into it, I had a really interesting event. Anyway, similar thing. Long story short, she basically lost 15 kilos, improved her health in many ways, like lots of improvements overall for them as a couple. And then about 5 months later, she was pregnant for the first time ever,
On her
again,
own.
naturally.
Amazing.
And, after multiple failed cycles and things that hadn't worked.
Okay,
You
so
name it.
listeners, buyers, really beware. When you want or need a fertility specialist, don't, do your own vetting or find,
I think it's
referrals or
like exactly. And
yes.
what you're saying, I think that it's even another step. It's
Mhm.
actually look at the track record of the person who actually is providing the treatment. And this is the other thing too, is the fact that, any fertility treatment is expensive. So, and we know that in terms of IVF, 70% of cycles fail.
Mhm.
So if that's the case, and we know also published data that you have an average of 8 IVF cycles to get a close to an 80% live birth rate, you're talking the cost of a house in
Mhm.
many states, in many
Mhm.
countries,
Mhm.
and so there's all of those issues that I think are important to take into account. So I thought, you know what, 2 years sounds like a good plan. But the other reason why I picked 2 years was actually that I felt these two women showed me a very interesting thing, which was why I ended up picking 2 years or more. They weren't anxious
Mhm.
and, you know, like over the top, like, oh my God, I need to get pregnant by yesterday. In
Mhm.
fact, they were quite resigned about never getting pregnant
I see.
again, ever in their
So
life.
you
They
could
were
take
like,
that variable out. You could take the anxiety variable out. Yes.
precisely, exactly. And what I look at is that if we're looking at a continuum, so let's say that, putting my hand above my head now, and let's say that optimum fertility belongs there. And let's say that somebody's starting like around my chest
Mhm.
at wherever they're starting. And that's the kind of quote unquote infertility start point, right?
Mhm.
Now, for some people, they don't need to get all the way through to optimum fertility to have a baby. They just need to get to like up to my neck.
Mhm.
Of course, the more that somebody will do to improve and optimize their health, the better their life is going to be in the long term, the better the generational health and their children's children is
Mhm.
going to benefit. But in order to have what society deems a healthy baby, right, you're going to need to really, in some instances, close a very short gap.
Yeah, I see what
It
you're
is
saying.
not, a massive gap.
Yeah.
There's a big misconception that happens. People think that, oh, it takes 3 to 4 months to prepare for, whatever. No, because an egg maturation cycle happens in 2 phases and it takes up to a year for that to occur. From primordial follicle, which is all the eggs we'll ever have, to primary follicle takes about 6 months. From primary follicle to ovulatory follicle, we're looking at another 4 to 6 months.
Any improvement is improvement, right? So
Exactly.
whatever changes one can make today to improve one's, I'll speak to people with ovaries, to improve one's ability to ovulate a healthier egg in 3 months' time. Start now.
There's a couple of things that I'll say about this. The first thing is that yes, environmental exposures make a difference, and at the same time, they're not treatment.
Mm.
So where is this important? Diet is extremely important, and you will be able to reduce inflammation in the system. I recommend all my patients be gluten-free, dairy-free, and that they're eating, close to, whatever it is that they're seeing on the field is essentially how they eat that food on their plate. And that is very important, but that is a foundational piece. That is an important foundation upon to overlay effective treatment. If we look backwards, like I often say that whatever we're talking about right now, whether it's inability to keep a healthy pregnancy to term, failed treatments, quality of the eggs, quality of the sperm, these things are outcomes. They are results of many biochemical chain reactions that start all the way at the very beginning, like, right there in kind of stage 1, right? What's going to have the biggest impact on that in the short term is not the same as what will have that impact in the long term. So the interventions that we're talking about in terms of, diet has some kind of short term impact, and then obviously more long-term impact. If you want to understand more about what I mean there, is that, for example, if you keep eating saturated fats every day of your life for 40 years, at the end of 40 years, you probably will have some blocked arteries. But that has taken 40 years to develop, right? When it comes to fertility, we don't have that kind of time span to actually be able to make differences in the long term. So that's why I actually don't agree that diet and lifestyle is effective treatment. So we've not, plastics, phthalates, bisphenols, all of these things will make a difference, but they are usually much more long term.
Although,
And so,
if I may, ultimately, optimally long term, but we can see changes in the follicular fluid pretty quickly if we take out some of these things that create the consequential inflammatory markers or the microplastics in
yes.
the fluids.
And if we're still having the infections that are not diagnosed, and if we're still having the hormonal imbalances that need to be addressed, and if we're still having, the sperm be poor quality, it makes no difference.
So you mentioned testing. Do you have a preset list of and you mentioned systems and you mentioned testing in order to get the proper diagnosis? Do you have a preset set of labs that you would want to see? And then you also mentioned bacteria, so I imagine there must be like a gut microbiome component that you're looking at as well.
Well, it's all of the things, and sometimes even just infectious, like, literally sexually transmitted infections that are undiagnosed, So yes, microbiome, but then you also have to have a look at, we did a meta-analysis in the clinic looking at the effect of bacterial vaginosis associated bacteria on sperm and sperm quality. Nobody has 40 years to get pregnant, not even if you start at 10. And so what happens is that you are going to end up with a situation that many of these outcomes that we have, which is inability to conceive, inability to keep a pregnancy to term, egg quality issues, which are already outcomes, are outcomes of the combination of these multiple minor factors that happen and precede it. So, and this is where the diagnostic is not just about going through and doing blood tests, doing blood work, doing ultrasounds, the diagnostic is also understanding what is the biochemical pathway that's being affected based on these outcomes that we have seen precede the issue in this particular situation. It's a 4-week program that is completely free, that literally educates people on the things that that they need to know, whether it is nutrition, how to move, what diagnostic tests are the basic core that they need to get done. You know, all of these things that are like the minimum kind of
The beginning. Yeah.
the very foundational paths that everybody needs to know and be implementing, you know.
Hey there, thanks for joining the conversation at Health University, where we're committed to making ourselves just a little bit smarter about our whole health and our reproductive health. Make sure to hit the subscribe button as well as the bell so you don't miss a future episode. Leave a comment below, especially if there's a topic you want to learn about. We're happy to know and to include that in our episodes. And since 1 in 5 people are determined to be struggling with fertility, share this with 5 people. You're bound to help at least one change the course of their fertility struggles and help realize their dream of family. We value your time and we keep these recordings as succinct as possible. But if you want to listen to the full episode, just click below and the entire episode is there at your disposal. Once again, thanks for joining us at Health University.